Tarun,
Hi, sir.
good morning.
Hi, sir.
How are you now?
I'm good, sir.
So, ಎಷ್ಟು ದಿನ ಆಯ್ತು ಸರ್ಜರಿ ಆಗಿ? How many days now?
This is my 28th.
28th day. You're happy?
Yeah, I'm happy, sir.
You're very happy.
I'm very happy.
Congratulations. All your colonoscopy, your biopsy reports are all normal.
Yes, sir. Thank you, sir.
Okay, because we saw some colitis features in
Yes, sir.
ileum, small intestine, and we have done all the investigations. We have done the biopsy. We have done fecal calprotectin. So all were normal.
Yes, sir.
So be safe that your fistula is due to bacteria.
Yes, sir.
Clear?
Yes, sir.
Okay. And now tell me, when did fistula start first?
Sir, first I got like a pimple like in April.
Okay, April
So,
of 2024. Okay.
So I thought it's like some normal pimple, like so I neglected it. Again, October, September, again I got a like pimple like that. First started coming.
So you thought it is a pimple,
Yeah,
and you neglected.
yeah, for 3-4
Okay.
months. Then I went to another doctor. There they told we'll clear it. They'll clear the fistula. And after getting once operated there, again after 2 months it came.
So you went to your doctor, they operated. Did they do MRI scan before operating?
Yeah, they did MRI scan.
Okay.
Again after getting operated on again another spot I got abscess.
When did you get? April you got a pimple.
April.
When you got operated?
I got operated in October 20, in the end October.
October you got operated. So April to October, you were comfortable, happy, or disturbed?
I didn't have any disturbance. It didn't affect me much. But the pimple thing pus used to come out.
So pus used to keep coming out. Your clothes used to get wet.
No.
But pus used to come out.
Come out, yeah.
Okay. So October you got operated. Then what happened?
Then I went to another doctor.
Okay.
Near this is of Koshias.
Okay. Okay.
There he told us it's a fistula. Then we did an MRI. Then we got operated.
Again you operated?
And there only.
There only. Okay.
The doctor which I met. So the surgery failed there.
Okay.
I again got abscess in another spot.
Different spot. Okay.
That time, the second time I got an abscess, there's too much pain was there. I was searching everywhere where to go. Then you in Google only I saw your hospital. I saw your reviews. So I came here, sir. Now this is my 28th day after operation.
You're happy?
I'm happy, sir.
Feeling well?
Yeah, it's
You're doing walking, exercise, everything?
Yes, sir. Walking, exercise, I'm eating normal.
After October, you said you quit your job.
After October, I was doing I used to do a marketing job.
Marketing.
Where I used to travel a lot in bike. So I had this pain. That's why I quit my job, and again I'm looking for a job.
You're looking for a job now. So you quit your job only because of fistula. Okay. So now you're looking for a job, and you're happy to work now.
I'm happy to work now.
You're happy to work now.
Yes, sir. Yes, sir.
Okay. So, when you did the first fistula surgery, colonoscopy was done for you?
No, sir, no colonoscopy.
No colonoscopy was done. Only MRI scan was done.
Only MRI scan.
Okay. So, can I have the file?
Yes, sir.
Yeah. So, my dear friends, so here I have a young man who had a fistula in April. He said that he thought it was a pimple. So, many people think that around the anal canal, if they develop a fistula, many people think it is a pimple, and some go to the dermatologist. So only when it becomes severe, when the discharge becomes more, then they seek help of a surgeon. So never mistake a pimple around the anal canal as a pimple. It may be a fistula, or it may be a pilonidal sinus or a pilonidal abscess. So young man noticed in April up to October, he assumed to be a pimple, and he did not seek a medical help. So in October, he has gone to a surgeon, and he was operated. After surgery, in the same place, there was recurrence, and he also got one more abscess in another region. So he reached out to us about a month back, and we did a complete evaluation. Whenever a fistula reoccurs, or whenever a fistula is multiple, like one or two fistulas, we have to follow proper protocols. For example, we did a colonoscopy for this gentleman, and colonoscopy, we saw ulcer in the ileum. So generally, whenever fistulas are there, or recurrent, or one or two fistulas, or multiple fistulas, we do a colonoscopy. So there is ulcer. Why colonoscopy is important and ulcer is important is 90% of the fistulas are due to bacteria. Remaining 10% are due to tuberculosis, ulcerative colitis, Crohn's disease, chlamydial infections, and many other causes. So basically, we have to find the root cause analysis, and that's why we do colonoscopy. And there was an ulcer. We did the histopathology, and fortunately for this young man, it was just simple colitis. We confirmed it by doing a fecal calprotectin test, which is mandatory whenever there is ileitis and some histopathology changes. And we did a complete workup, and everything was normal, and his fistula was purely due to cryptoglandular infection, bacterial infection. So when he came to us, he had a very complex fistula, 2 tracts like this, and also he had another section, you see, tracts like this. We have done a laser procedure. It is 28th day now, and it is completely normal. So young man is happy. Unfortunately, after October surgery, he had to quit his job since it was a marketing job, and he wanted. It made him ride the bike every day. So now he's happy and seeking for a job, and happily smiling with a complete fistula cure. So the message here is recurrent fistulas should be seen in detail. Number 1. Number 2, never mistake a pimple. Number 3, colonoscopy is mandatory in the fistula surgery. Number 4, MRI scan is mandatory to map the fistula. Thank you very much.
Thank you, sir.
Thank you, Tarun. All the best in your career. All the best. Okay, yeah.